Hey, I'm Anastasia. This is Anastasia's Hump Day Happenings, and you may hear some children screaming with glee behind me, which means they're enjoying being outside for the summer. It just makes you smile. Speaking of summer, I've got 5 summer health tips to keep your enamel fit. Number 1, we're going to go with the beverage category. So in the news, carbonated water was asked about hydration and does it really work? So here we go. Carbonated water has a very low potential to demineralize your enamel. And the reason for that, if it's truly carbonated water, which, pay attention, without sugar, sodium, or other added ingredients, then fine. Other carbonated drinks, moving forward, pay attention to the sodium, the sugar, the added ingredients in carbonated beverages, sparkling waters, sparkling wines such as Prosecco, sports drinks, sodas, and yes, even wine. I'm not saying that this is like the whole bad thing, but I am saying if you already have tooth sensitivity and enamel erosion, you got to pay attention to certain things like this. Now that group has the potential to drop your pH by 3.0 down to 2.5. Healthy pH is 7. Now some of you might say, okay, Anastasia, what about your coffee? You drink a lot of coffee. Coffee itself, without the added stuff, is a 5.5 pH in your mouth. I say drink more coffee and it'll help you live longer too. What do you say? And apple cider vinegar, huge trend for weight loss. A lot of people just tossing it back in a shot glass or adding it to their water. What you have to realize is vinegar has an acidic value also, potential to erode your enamel, and that is at a 3.9% down to 2.7% of a pH. Also in that category, you're likely drinking water in the summer to hydrate. How much lemon are you putting in your water? How much lemon are you putting in your tea? Lemon will contribute to enamel erosion. Number 2, chlorine in your pools. I'm not talking about dipping your toe in the water. I'm talking if you're in it all the time, know that the chlorine in mountain pools can contribute to enamel erosion. Number 3, morning sickness. Ugh, tough one. First trimester, 3 months. Every time that you do vomit, that acid is in your mouth. Please do not go for something like a carbonated beverage afterwards. We really have to stabilize your oral environment, and that's hard to do because you just feel like crap. But stick with it and ask your hygienist for other options. Number 4, GERD, acid reflux. I know it's around all year long, but you take this and diet choices and add it to what we just discussed, whoa, your enamel doesn't have a chance. Number 5, dental products. Yes, dental products. And here's what I want you to ask your hygienist for your health and wellness visit. What is the coarse grit that they're going to use to polish your teeth? The more coarse that it is, it's going to take off a little bit of enamel. Now, mind you, I know it's not a lot, but given all the other contributing factors, why is this so important? I just got this in our dental hygiene magazine, and just to show you the danger zone, and then when you're coming along here to see what's healthy for healthy pH, it really matters. And then I'm going to flip it around. Healthy enamel, and then taking it down to this. Doesn't happen overnight, but it can happen. And once that enamel is gone, you don't grow it back, and it can contribute to tooth sensitivity. And let's just face it, it doesn't even look pretty either. So I hope this helps you out understanding some health tips to keep your enamel fit. Now you got a question for me? Ask it. Now, like this channel and join me every single week. Comment and share with your friends. And until next Wednesday, take what you learn and make a difference with it.